Welcome to the City of Port Colborne's Accessible Customer Service Training. This training is a mandatory requirement under the Accessibilities for Ontarians with Disabilities Act. Did you know that approximately 1.8 million of all Ontarians have some form of disability? That's 15.5%. These figures will increase as the percentage of an older population grows. By 2026, approximately 16% of all Canadians will have some form of disability, and people with disabilities are also customers. Presently, people with disabilities have a spending power of $21 to $25 billion a year in Canada. Often when we think of a person with a disability, we think of someone with physical limitations, but there are many other forms of disability and some that are non-visible. It's important to remember when providing customer service, you are not dealing with the disability, you are dealing with the person. The following video discusses what is a disability and the different types of disabilities.
I've never tried to define disability for myself. It's one of those things that you know about its existence. You see individuals that have challenges, but on a day-to-day basis, you don't really think about it as part of your life until it becomes part of your reality.
I like to put ability instead of disability. I like to say, okay, I'm disabled, but with lots of abilities.
All disabilities, people with disabilities, have challenges because they either have a physical or a mental function which isn't working just the way everybody else's works.
Do you know what a disability is?
My impression of a disability is someone who may just need a bit more time or assistance.
In my view, a disability is an artificially created circumstance. I'm totally blind, and yet for most of the time, I'm not disabled. For example, when I'm sitting in a restaurant and somebody hands me a print menu, which is usually what I get, I instantly become disabled. Some restaurants now carry a Braille menu. I'm no longer disabled.
It's easy for me to go to school, to run up the stairs, to go down the hallway, to buy a coffee, all those little things. And for someone with a disability, it's so much more than that.
A disability is only a detour to where you want to get to.
And it doesn't necessarily mean somebody in a wheelchair. It could be intellectual, it could be vision, it could be hearing.
Invisible or visible, sensory, mobility, intellectual, or mental health. That would be my definition of disability.
We're not talking about disabilities. We're talking about people with disabilities. So it's the person we're talking about.
Legislative background. The Ontario Human Rights Code provides for equal rights and opportunities and freedom from discrimination. The Code recognizes the dignity and worth of every person in Ontario. The Ontarians with Disabilities Act 2001, also known as the ODA, was developed to improve the opportunities for people with disabilities by identifying and removing barriers to full participation. This act requires that a municipality with a population of over 10,000 must develop an annual accessibility plan, consult with people with disabilities to develop the plan, make the plan available to the public, and have an Accessibility Advisory Committee, or AAC. The City of Port Colborne's AAC was established by the ODA, and this legislation has made great strides for Ontario. However, it has been limited to the public sector. The City of Port Colborne's AAC strives to remove barriers within the city and carry out its responsibilities under the ODA. The AAC is dedicated to promoting equal opportunity and access for all persons regardless of needs to participate as fully as possible in all aspects of community life. The provincial government decided that the legislation regarding accessibility was not broad enough. Therefore, in 2005, the Accessibility for Ontarians with Disabilities Act was passed. This is also known as the AODA. The purpose of this legislation is to achieve a fully accessible Ontario by 2025, and its standards will be applied across public, broader public, and private sectors. There are 5 standards. Customer service. This standard legislates the requirements for providing accessible customer service and is the reason that you are participating in this training today. The City of Port Colborne's Accessible Customer Service Policy requires training in the provision of accessible customer service every 3 years. The accessibility standards for employment, information and communication, and transportation have been combined into the Integrated Accessibility Standards, and the requirements will be phased in between 2011 and 2021. The 5th standard is the Built Environment, which now applies to new construction and extensive renovation and is regulated through the Ontario Building Code. This policy lays out the principles of accessible customer service, assistive devices, service animals, support persons, notice of service disruptions, training requirements, and feedback. The report and policy can be found on the city's website. The provision of customer service must be consistent with the principles of accessible customer service as follows. Dignity. Service is provided in a respectful manner consistent with the needs of the individual. Independence. Services for persons with disabilities shall support their independence while respecting their right to safety and personal privacy. Integration. Services allow people with disabilities to fully benefit from the same services in the same place and in the same or similar manner as other customers. Equal opportunity. Service outcome is the same for persons with disabilities as for persons without disabilities. The following video will discuss the importance of remembering that when you provide customer service to people with disabilities, your customers are your best source of information about their needs. The solution can be simple, and they will likely appreciate your attention and communication.
Persons with disabilities spend annually in Canada $25 billion. So it only makes sense that if you're in business, that you look towards that sector to improve your business opportunities.
And what does it end up costing me? I'll tell you, nothing. Very, very minimal. And what do I get in return? In the last 3 or 4 years, we've built 6 homes with varying degrees of accessible features in them. 6 sales that I would never have gotten if I hadn't even reached out and tried to make those accommodations.
So it's about incremental steps, and it's about small changes.
How can I help? Those are 4 great words. I had to count them up. How can I help? 4 great words, because they apply to anything.
You know, that's a very warm and engaging thing to say to someone with a disability. How can I help you?
Often we're afraid to ask because we think we're going to offend, but sometimes the easiest way to learn is to actually ask the person about themselves and how can I help you to participate with me in whatever we're doing.
We all have to help each other.
By saying,
How can I help?
How can I help?
How can I help?
How can I help?
How can I help? Physical disabilities include a range of functional limitations from minor difficulties in moving or coordinating one part of the body through muscle weakness, tremors, and paralysis. Physical disabilities can be congenital, such as muscular dystrophy, or acquired, such as tendinitis. People who have arthritis, heart or lung conditions, or amputations may also have difficulty with moving, standing, or sitting. A physical disability may affect an individual's ability to perform manual tasks such as holding a pen, turning a key, or gripping a doorknob. They may not be able to move around independently or control the speed or coordination of their movements. They may not be able to reach, pull, or manipulate an object or have strength or endurance. Remember these suggestions when dealing with someone with a physical disability. Ask before you help. Keep ramps and corridors free of clutter. If a counter is too high or wide, step around it to provide service. Provide seating for those that cannot stand in line. If having a conversation with a person in a wheelchair, consider sitting to make eye contact. Let your customer know about accessible features in the immediate area. Wheelchairs and other mobility devices are part of a person's personal space. Don't touch, move, or lean on them. If you have permission to move a person in a wheelchair, remember to wait for and follow the person's instructions. Confirm that your customer is ready to move. Describe what you're going to do before you do it. Avoid uneven ground and objects, and don't leave the person in an awkward or dangerous position, such as facing a wall or in the path of opening doors. Vision loss can restrict someone's ability to read, locate landmarks, or see hazards. Vision disabilities range from slightly reduced visual acuity to total blindness. Vision loss can result in difficulty reading or seeing faces, difficulty maneuvering in unfamiliar places, inability to differentiate colors or distances, a narrow field of vision, the need for bright light or contrast, or night blindness. Remember these suggestions when dealing with someone who may have a vision loss. Don't assume the individual can't see you. Identify yourself when you approach your customer and speak directly to your customer. Offer your elbow to guide your customer. If the customer accepts, walk slowly but wait for permission before doing so. Lead, don't pull. Identify landmarks or other details to orient your customer to the environment. When guiding, be clear and be precise when giving directions. If you're uncertain about how to provide directions, ask your customer how to do so. Don't leave your customer in the middle of a room. Guide your customer to a chair or comfortable location and let your customer know if and when you will be back. Do not be afraid or embarrassed to use words such as see, read, and look. People with vision loss also use these words. When providing printed information, offer to read, summarize, or describe it. For example, verbally itemize the bill. If the person uses a service animal, do not touch or approach the animal. It is working. Hearing loss can cause problems in distinguishing certain frequencies, sounds, or words. Remember these suggestions when dealing with someone who may have a hearing loss. Attract the customer's attention by using a touch on the shoulder or a wave of your hand. Ask how you can help. Don't shout and speak clearly. Move to a well-lit area if available where your customer can see your face. Don't put your hands in front of your face when speaking, as some people read lips. If necessary, ask if another method of communicating would be easier, for example, writing. Be patient if you are using a pen and paper to communicate. Be clear and precise when giving directions, and repeat or rephrase if necessary. Confirm that your customer understands you. If the person uses a hearing aid, reduce background noise or move to a quieter area if possible. Deaf-blindness is a combination of hearing and vision loss. The result for a person who is deaf-blind is significant difficulty accessing information and performing daily activities. Deaf-blindness interferes with communication, learning, orientation, and mobility. People who are deaf-blind communicate using various sign language systems, braille, telephone devices, communication boards, and any combination thereof. Many people who are deaf-blind use the services of an intervener who relays information, facilitates auditory and visual information, and acts as a sighted guide. The intervener will sign on the individual's hand. Some suggestions for helping a customer who is deaf-blind include: direct your attention to your customer, not the intervener. A customer who is deaf-blind is likely to explain to you how you can best communicate, perhaps with an assistance card or note. Understand that communication can take some time. Please be patient. Speech disabilities involve the partial or total loss of the ability to speak. Some helpful suggestions include: don't assume that a person with a speech impairment also has another disability. If possible, communicate in a quiet environment. Ask your customer to repeat the information if you don't understand, or to write the message and verify your understanding. Ask questions that can be answered yes or no if possible. Try to allow enough time to communicate with your customer, as people with speech disabilities may speak more slowly. Don't interrupt or finish your customer's sentences. Mental health issues can affect a person's ability to think clearly, process new information, concentrate, or remember things. Mental health disabilities include a range of disorders that can differ in severity. Some suggestions in providing customer service to someone with a mental health disability include: treat a person with a mental health disability with the same respect and consideration you have for everyone else. Ask what would make your customer the most comfortable and respect your customer's needs to the maximum extent possible. Be confident, reassuring, and patient. Try to reduce stress and anxiety. Stay calm and courteous and focus on the service needed. If someone appears to be in a crisis, ask the customer to tell you the best way to help. Take the customer away from the situation, noise, and distractions to facilitate one-on-one service. The term learning disability describes a range of information processing disorders that can affect how a person acquires, organizes, expresses, retains, understands, or uses verbal or nonverbal information. Learning disabilities can result in difficulties in reading, problem solving, time management, wayfinding, and processing information. This disability may become apparent when a person has a difficulty reading material or understanding the information you are providing. Consider these suggestions for providing accessible customer service to someone with a learning disability. Learning disabilities are generally invisible, and ability to function varies greatly. Respond to requests for verbal information, assistance in filling in forms, etc., with courtesy. Allow extra time if necessary. People may take a little longer to understand and respond. Remember to communicate in a way that takes into account the customer's disability. For example, some people with learning disabilities find written words difficult to understand, while others may have problems with numbers and math. Be patient and be willing to explain something again if needed. Intellectual or developmental disabilities can mildly or profoundly limit the person's ability to learn, communicate, socialize, and take care of their everyday needs. It may be caused by genetic factors such as Down syndrome, exposure to environmental toxins such as fetal alcohol syndrome, brain trauma, or psychiatric disorders. A person with an intellectual disorder may have difficulty with understanding spoken and written information, conceptual information, perception of sensory information, or memory. Some suggestions for serving a customer with an intellectual or developmental disability include: use plain language and speak in short sentences. To confirm if your customer understands, consider asking your customer to repeat the message. Be prepared to explain and provide examples regarding information. If you cannot understand what is being said, simply ask again. Remember that your customer is an adult and, unless you are informed otherwise, can make decisions. Provide one piece of information at a time. Be supportive and patient. A person with a smell disability may have allergies or hypersensitivities to certain odors, scents, or chemicals, or may be unable to identify dangerous gases, smoke, fumes, and spoiled food. Touch disabilities can affect a person's ability to sense texture, temperature, vibration, or pressure. Touch sensations may be reduced or heightened, resulting in a hypersensitivity to touch, temperature, or the opposite, numbness and the inability to feel touch sensations. Taste disabilities can limit the experience of the 4 primary taste sensations: sweet, bitter, salty, and sour. A person with a taste disability may be unable to identify spoiled food or noxious substances. Medical and temporary disabilities can result from a range of conditions including accidents, injuries, illnesses, and diseases including ALS, asthma, diabetes, cancer, HIV or AIDS, environmental sensitivities, seizure disorders, heart disease, stroke, and joint replacement. An assistive device is a tool, technology, or other mechanism that enables a person with a disability to do everyday tasks and activities such as moving, communicating, or lifting. Personal assistive devices can include things like wheelchairs, scooters, walkers, braces, computer software programs, hearing aids, glasses, special adapted pen or pencil, white canes, or speech amplification devices. Some suggestions for providing accessible customer service to an assistive device user include: don't touch or handle any assistive device without permission. Don't move assistive devices or equipment, such as canes and walkers, out of your customer's reach. Let your customer know about accessible features in the immediate environment that are appropriate to their needs, for example, elevators and accessible washrooms. People with vision loss may use a guide dog, but there are other types of service animals as well. For example, there are hearing alert animals, as well as animals trained to alert an individual to an oncoming seizure. Service animals are not always guide dogs and may be a cat, a snake, or even a ferret. These types of animals are rare, but are often used for people with a mental health disability in order to provide assurance and a calming effect. Service animals must be allowed on parts of the premises that are open to the public or to other third parties, unless the animal is otherwise excluded by law. If a service animal is excluded by law, under the Accessible Customer Service Standard and the city's policy, you must find another way for people with service animals to access your goods or services. Avoid making assumptions. If you are not sure if the animal is a pet or service animal, ask your customer. You may ask for a letter verifying that the animal is required for reasons relating to the customer's disability if it is not readily apparent. Avoid touching or addressing service animals. They are not pets. They are working and have to pay attention at all times. Provide the location of fresh water for the service animal and where the service animal may be walked to relieve himself. Some people with disabilities may be accompanied by a support person. A support person can be a personal support worker, an interpreter, an intervener, a volunteer, a family member, or a friend. A support person might help your customer with a variety of things, from communicating to helping with mobility, personal care, or medical needs. According to the Accessible Customer Service Standard, a support person must be allowed to accompany an individual with a disability to any part of the premises that is open to the public or third parties. Admission fees for support persons, if any, must be posted on the city's website and anywhere else where fees are posted. If you're not sure which person is the customer, take your lead from the person using or requesting the goods or services, or simply ask. Remember to speak directly to your customer, not to their support person. Under the Accessible Customer Service Standard, and according to the city's policy, if you offer facilities or services for people with disabilities, such as an elevator or accessible washroom, you must let people know when the service or facility is out of order. Notice of temporary disruptions and the anticipated duration of the disruption must be posted in a visible place, on the city's website, or by any other method that may be reasonable under the circumstances, as soon as reasonably possible. The law says we have to work with a customer with a disability to find an alternative method of accessing the service that is reasonable to both the city and the customer. If your customer is having difficulty accessing city goods or services, always work with your customer to find an alternative method of accessing the service. Alternative formats include providing large print versions of a document or sending it electronically so that their program can read the text to them, having a document translated into Braille, or having a sign language interpreter present during a meeting. Closed captioning is also an option, as well as audio. You can also help your customer by reading the information out loud, writing down instructions, or drawing a diagram. As a city employee, volunteer, board member, student, or contractor, take the time to understand the needs of each customer. Identify and remove barriers that prevent people with disabilities from fully participating in the community. Please note that barriers are not just architectural or structural, for example, stairs. Barriers can also be information and communications, such as printed material that is too small, or barriers can be attitudes or stereotypes. Treat all customers with respect and give them your full attention. Take time to understand the needs of each customer. Understand the nature and scope of the services you provide. Be open to working with people with disabilities to find the best solution. Accept feedback and make sure that feedback is communicated to those who can effect changes. It's important to remember, you are not being asked to provide a new or different service, just to provide the service you offer suited to the individual based on their needs. Always remember, if you are unsure how to help a customer, your first question should always be, how can I help you?